General Physician PC is excited to announce the launch of a new program aimed at improving the coordinated care of patients throughout Western New York.
I come from Erie, Pennsylvania, and what brought me to General Physicians in Western New York is Kaleida Health had a desire to fix some of the problems in the post-acute space. And the post-acute space is that space after you leave the hospital, but you can't go back home alone. And right now that is covered in piecemeal by home health care, the visiting nurses, and multiple skilled nursing facilities. Kaleida has 2 facilities that they manage, High Point and Terrace View. And they realized that there were some gaps in care, that patients weren't necessarily being served to the fullest efforts that the community could bring to them. Post-acute care involves that patient that has to leave the hospital after an acute stay, but is not capable of taking care of themselves alone at home. So it is a very broad space and it is poorly defined. Right now it involves community partners that have skilled nursing facilities, nursing homes is what they used to be referred to, the home health agencies that provide bridge care, and then some of the other agencies within the community that bring caregivers into the home to help people to their maximum level of independence and function.
Healthcare can be confusing, but here at GPPC, their mission is to help address your concerns.
I get people more involved in asking the questions of, if I need that level of care, where am I going to go? And proactively making an informed decision. What I recommend is when you're driving around your community and you see a facility that you think you might like, you should go in unannounced and ask for a tour. You should go in and ask questions. You should ask your friends and family members where they went. So you should have that conversation about where you want to receive your care in that post-acute space in a time of wellness, and you should go out and physically visit the buildings. Patients were going to the post-acute space, they were discharging from a hospital, and they weren't necessarily getting better. They were bouncing back and forth from the hospital and back to a nursing home. When we looked at numbers just at Kaleida, we saw almost 30% of patients within a month of discharge from the hospital to a skilled facility came back to the hospital. So that is unacceptable, really. If you're receiving care, you want to be in a progressive transition. You want to go from a less and less restrictive level. Our hope is that by producing a committed service line, focusing on quality and patient outcomes, that the community as a whole realizes that and increases the level of care and quality that they produce. The benefits of this type of a program, comprehensive post-acute care, are that you have an engaged physician and healthcare provider that warm handholds you through the process, where we provide a physician and a team of advanced practitioners, nurse practitioners and physician's assistants who spend time with the patients, who look at their medications, who do what we call reconcile. We look at what they were on at home, what they're on in the hospital. We figure out if that's the best approach for them. And then when they go back to their primary care physician, we send a committed summary of what we've done in that space to get them back to their primary care physician.
Cost is always the big concern when talking about your health. So do insurance companies typically cover this type of care?
Almost all insurances have the benefit of skilled nursing. I think one thing that people don't realize is if you have a community commercial insurance, Blue Cross, Independent Health, a lot of those payers have a benefit that doesn't require you to go to the hospital.
So if you or someone you know would like to learn more about post-acute clinical care, all you have to do is give them a call at 716-309-GPPC or visit them on the web at gppconline.com.